Hello, everyone. My name is Jeffrey Walton. I'm the editor-in-chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. Today, our guest is Jeff Legere, president of Shoppers Drug Mart. Jeff, welcome.
Hi, Jeff. Nice to be here.
Great to have you. And I should say that Jeff is the current Retailer of the Year for Chain Drug Review, and we named him that in January. We still owe you an in-person event and our other honorees as soon as COVID allows. So we intend
Looking forward to it.
Okay, terrific. Jeff, as always, a lot going on at Shoppers Drug Mart. Recently, you opened your first freestanding health clinic. Maybe you could tell us a little bit about what is on offer there, and assuming the format is successful, how it will interact with your pharmacies.
Sure. Yeah. So the official opening was yesterday. So it was up there here in Toronto. And it's something that we've been thinking about for some time. Like many other chain drug stores, we have relationships with medical clinics. And we thought the next evolution of it against our health strategy was can we manage them? Can we actually get a more integrated kind of feel for the customer and for patients in terms of making sure that they have seamless access to healthcare. So we were very excited about launching the health clinic for Shoppers. And as I said, it's here in Toronto. And the whole concept is to take a primary care practice and make sure that it has the latest technology, make sure it's well integrated with the pharmacy. It's actually co-located next door to the pharmacy that we have. So in terms of services, it is a primary care offering. There's family practice, there's walk-in. There's a big utilization of technology. As I think we've shared before, we have our own electronic medical records company called QHR and the Acuro platform. So it has that suite of offerings. And it's just a consistent technology-driven kind of standard of care. So we think that there is a real need for that and kind of bringing things to a bit more of a standardization. And the initial feedback's been really great. We're very pleased with the start.
Okay, it's an exciting concept. Canada has done much better than the US in terms of containing COVID-19. But it's still made new demands on healthcare providers, including pharmacies. Maybe you could talk a little bit about how COVID has impacted your business and your thinking about the role of community pharmacy.
Yeah, so it's been a real interesting journey, obviously, for all of us in this sector in terms of adjusting to the requirements for public health, in terms of keeping employees safe and keeping customers safe during very trying times. So I think like a lot of people, we saw really kind of big shifts in customer behavior in terms of what's been happening. We saw a surge in prescription filling when it first started, and people were worried about running out of medications, especially for chronic meds. And then we had big dips in terms of how that was playing out from a prescription perspective. And as you know, we have a pretty well-balanced front shop business in terms of our pharmacy. So more than half of our sales come from the front of shop. So we actually saw a lot of changes in behavior there. A lot of, obviously, household cleaning and sanitary products in the beginning, lots of hoarding, even toilet paper. And that very quickly shifted to food. We were a very big food player, including fresh food. So as grocery stores had long lineups, we saw our food shift and grow at well north of 20%. So we were seeing some really great momentum on that. It's almost like customers were continuing to discover our offering on that front. So that was great. We saw changes in beauty. So huge changes in terms of we're not alone on that front. Obviously, when you think about necessities during the pandemic, prestige cosmetics was not at the top of the list, especially around color. So we saw some change on that front. Now a lot of it's coming back, mostly around skincare and elements like that have come back nicely. And the real interesting one is around cough and cold and OTC sales. So there was a big jump in the beginning where there was some kind of stocking up, and then shelter in place or stay at home and social distancing also works quite well for cold viruses. So we saw some declines on that front. So that's kind of all happened during the second quarter. We looked at hours of operation and delivery and driving more around e-commerce. Like there's very similar to other people. And I'm quite proud of how the team has performed during that period of time, and our store concept has done very, very well. So we're very happy. And we're continuing to adjust as we kind of come out and the consumer behavior starts to change a little bit. On the health side, there is really some interesting things that happened. So other than prescription filling in Canada, there was some loosening up of expanded scope of practice for pharmacists. So as physicians' offices were not open as much or moving to virtual, we saw our pharmacists step in and help provide continued care for chronic disease or help with acute access to acute meds, which actually I think will help drive our strategy in the future, because we really are of the view that primary care needs to start at pharmacy and needs to happen in the store. So that was really, I think, a great learning. And then we also have some virtual care tools, which we had a chance to test. And I think like everybody else seen in North America, we saw some great adoption from customers. So that also makes us quite bullish around our health strategy in the digital health space.
Mm-hmm. And how many of these changes that you've described you think will stick, will have staying power? I mean, you mentioned the changes in pharmacy. Will the provincial regulators allow you to maintain that level of service after COVID is gone?
I think so. I think we've had really good interactions with our provincial regulators and also our provincial governments. We've been there to help support. We've been open all through the pandemic. We've been doing some asymptomatic testing in jurisdictions like Alberta. So I'd say that I think there's a very big openness to actually adjusting how care is delivered in the country. And I think they see the value of pharmacy and pharmacists, which is really, I think, encouraging.
Mm-hmm. And do you expect your food business to be more robust in the future? I would think, as people get to know you, what you have to offer in that department.
Yeah, as you know, we're part of the Loblaw family of companies, and obviously to have access and have the support of a food-driven supply chain on top of our pharmaceuticals and beauty business has been an amazing enabler. And we have trusted brands on that front, which have great customer recognition. So I think the food is going to continue to be a big area of growth for us. So we're excited about that.
Mm-hmm. In addition to the new health clinic format and your drugstores, you guys operate Wellwise home health care centers, and you have a couple beauty clinics where people can get non-surgical beauty treatments. Maybe you could tell us a little bit about those formats and how they fit into your long-term strategy.
Yeah, the Wellwise business is a relatively smaller unit. And we rebranded it a few years ago. It actually used to be called Shoppers Drug Mart Home Healthcare, and we were very purposeful about rebranding it. We wanted to really focus on a concept of aging powerfully, so actually encouraging movement, and there's a movement towards people aging at home. So there's a whole bunch of areas that blends that active lifestyle, but also still meets the needs from a home healthcare perspective. And it's doing well, obviously impacted a little bit by COVID, but we think the concept resonates, and we're continuing to look at how to expand it even through e-commerce, which also has spiked during this period of time. So we think that has, I think, strong momentum, and obviously with an aging population, it's going to be really important to continue to have that. In the beauty clinic, obviously we're Canada's largest beauty player across our luxury, prestige, and across mass and skincare. So it made sense, because of the trust that we have with Canadians in beauty, along with health, to extend into this area, which starts to see treatment around derm treatments, whether it's Botox, fillers, laser, and other skincare treatments. And the two concepts that we've had haven't been open that long. One's been open about a year, and the other one's about a year and a half. We've been very pleased with the performance, and still have a proof of concept at the moment. It was impacted by COVID. Obviously, it's not a necessary service at that time. Mm-hmm. But they're back open now that we're kind of coming out into phase 3. And we're seeing good adoption, and I think more to come on that front, but it does fit nicely with our brand, and consumers really did respond. You also have an opportunity to earn loyalty points through services, which is a unique offering in that area with our PC Optimum too.
Another thing that Choppers has been noted for is its entry into the medical marijuana business. Maybe you could tell us what that entails for our U.S. audience, and has it met expectations both in terms of patient care and as a business proposition?
Yeah, it's medical cannabis is a complicated business. The whole sector has been an interesting area to work in. We started with the premises that people are using it for medical purposes, and obviously with the legalization and the slowly growing body of evidence for certain utilizations, not as first line, but and certainly within the overall treatment, that it's an area that we should be in. We should be there to help support our patients in a way where they get trusted advice, a trusted brand. We apply the same principles of quality that we have. We run our own generic drug company. We have our own distribution center, so we're very familiar with regulated distribution of medications. So we got into it, and we run it here in Toronto. We ship nationally. Today, you can't dispense it in pharmacy. It is actually shipped to home. So we're still waiting to see if that goes into pharmacy over time. We're hopeful that it will, because it makes sense if you think about having a complete profile. But it's been growing nicely. It's certainly a very complicated area, and we think that it's going to be important to kind of stay in that area and continue to provide that service for patients. And we've seen it continue to grow all through the COVID pandemic too. So it's just been interesting.
Mm-hmm. You touched on this before. You talked about your digital transformation and your growth in e-commerce. Perhaps you could elaborate on that a bit.
Yeah, so we have an e-commerce platform for beauty. We've had it for a couple of years now. So we sell our prestige or luxury beauty along with mass, and also derm and fragrance and other kind of healthcare components. And it's been great, and we've seen a massive surge in it, obviously through COVID, when it was difficult to go into store. So we're pretty pleased about that, and we see the importance of an omni-channel experience in beauty. We think you need bricks and mortar, where you have the advice of a beauty advisor, which is really, I think, key differentiator for us. But you also need to have an e-commerce channel as it relates to beauty for replenishment and other kind of educational components. And then you also need to have a really strong social media presence. So we've been working on all three of those areas, and we saw great performance during COVID, and we expect that to continue as we kind of come out of that area.
And do your healthcare providers, your pharmacists, use digital tools to communicate with patients at this point?
We have a digital pharmacy app where you're able to actually communicate on refills and also but through text. So that's been working well. We have a health platform that we're about to launch very shortly that will allow us to have a broader health conversation with Canadians. Mm-hmm. And that's going to happen a little bit later in September. So yeah, there's a series of tools that we plan to add. Mm-hmm. And there's also some patient communication tools that are within our EMR to help facilitate physician communication through secure messaging and things like that.
Okay. It's exciting stuff. You mentioned before that you were acquired or merged with Loblaw, I guess 7 years ago now. Maybe you can talk a little bit about how that's benefited your customers at Shoppers Drug Mart, and I assume Loblaw's seen some benefits as well.
Yeah, it's really been a phenomenal combination of really two great Canadian companies, and you can go on for a long time about the benefits. Some of the key ones for us have been access to some of the best control brands in Canada. Some of the brands that were under the Loblaws, like President's Choice and No Name, are some of the top consumer brands in Canada. So that's been a good combination. I've talked about the food before, having that expertise of the distribution network, and also the merchandising help complement what we do well already within the drug channel. And then the combination of the loyalty programs, our Optimum program with PC Plus became PC Optimum, which has an enormous penetration in the Canadian population. People are able to earn earn points across drug, across fuel, and also across grocery, which has been, amazing in terms of the applicability of the Optimum program, and just culture. It's gone extremely well. Customers really, I think, really appreciate the advantages on that front.
I appreciate your time today, Jeff. It's always great to catch up with you. Thank you.
Thanks, Jeff. Thanks for your time.